Okay, so for my second focus case, I chose to focus on a GI or digestive case. I've only had maybe like two encounters with that, so it's something that I definitely haven't seen a lot of and something that I feel like I need more experience with. Um, Hopefully, as this semester continues, I'll be able to actually get experience with one of those. But for now, we have a focus case. Okay, so first off, this patient came in and they had an on the job injury. They worked for a roofing company, and while on the job, they were up on a roof and one of the slats on the roof was loose. He stepped on it, fell off the roof, and fell about 35 feet to the ground. Okay, so that already doesn't sound very fun. So, um, when he hit the ground, he did lose consciousness for a little bit, so he doesn't remember the exact details of the injury. But after this happened, he was life flighted to Grady Hospital. He was kept in ICU for a few days. He underwent a reconstruction surgery of his left wrist because he had shattered it. Um, Again, sounds lovely. Anyways, once that happened, he was released from Grady and told to visit an orthopedics clinic, so he came to us. All right, and when he came to us, he was still having some pretty bad pain in his wrist, but the majority of his pain was actually in his chest. You know, he was having difficulty breathing, inhaling and exhaling, and he felt like he had a really large amount of pressure on his chest. So, this being said, he was given some tramadol, which is a prescription strength anti-inflammatory medication for pain. And when we prescribe tramadol, we always warn patients to never take any other type of NSAID with this medication. It can cause stomach issues, and it can cause ulcers, and it can cause GI bleeds. All right, gave him the information, sent him on his way, and we were going to follow up with him in 4 weeks. Well, 4 weeks went by. He came back. At his first follow-up, he reported his pain being much better. He no longer had difficulty breathing, no more pain with coughing, sneezing, or anything like that, and the pressure on his chest felt relieved. The pain on his wrist was still pretty bad, and since his initial visit, he had already gone through another reconstruction surgery of his wrist, and this time he had a couple pins and screws put in. So when we went to take x-rays, we saw this, we asked about it, he told us what happened. So we said, all right, well, we're going to refill your prescription of tramadol for the pain. And then again, we'll see you back in like 2 weeks for another follow-up visit because he was scheduled to have another surgery like 3 or 4 days after this visit to get some of those pins taken out. All right, so and we also recommended a CT of his wrist and ribs for further evaluation. So, his next follow-up comes around, all right? This time he comes in and we're just double checking on the chest pain, making sure it's still gone, nothing else is happening, right? Well, this time he reported a constant burning in the chest. He reported that it had been occurring on and off since his initial injury and it was getting better until recently. He rated his pain as an 8 out of 10 and said it was a burning feeling right in the middle of his chest. And he told us that after drinking some water, he reported some vomiting and streaks of bright red blood in the vomit and told us that he had been having really dark black colored stools. He felt fatigued and lightheaded with standing. He denied any abdominal pain, diarrhea, radiating pain, pain with breathing, and shortness of breath. We asked if he had taken any other anti-inflammatory with the tramadol. Turns out he had. Even though we cautioned him against it, he said that his pain was just so bad that he felt like he had to take an Advil with the tramadol to get the pain to subside a little bit. So this being said, we figured that he had a GI bleed. We send an instant referral to the emergency room. Patient goes to the emergency room, and we didn't see him for a little while. When he came back, turns out he had a GI bleed. The emergency room gave him an IV and kept him under surveillance for about 1 to 2 days just to make sure that he was all right. He was released. So yeah, that's my GI encounter. One of the things that I did learn during this experience was how to educate patients on taking certain medications and to really be confident in what medications they can and especially cannot take while taking a certain medication. So, like, obviously, I know you're not supposed to mix medications. That's bad. We all know it's bad. But in this particular instance, I don't really feel like this patient understood the ramifications of mixing the two medications, even though we warned him against it. It can have very adverse side effects and very serious side effects if not caught right away. Thankfully, we did, and he was able to get better. We are still treating him for his wrist pain. All the pins and screws have been taken out in case anybody was curious. But yeah. So thanks for listening. Hope you learned something.